you, our viewers, to text us your questions. And now Dr. Georgine Nanos, physician and CEO of Kind Health Group, joins us over the phone to answer your questions. Welcome back. Good morning to you.
Good morning.
Okay, so let's start with our first question. So our viewer says, I live in Santee. I'm wondering, is it possible that COVID-19 virus was already here in January due to lack of testing? I ask because many of my colleagues became very ill, including myself, and knocked me down for 5 days in bed, flu-like symptoms, big as respiratory problems. It wasn't bronchitis or pneumonia, but I couldn't breathe. My doctor gave me an inhaler.
Yes, I do think it's possible. I think it may have been here because, like the reader, your listener said, we haven't had a lot of testing, so it's really hard to say with any certainty how long it's been in the community, and we are seeing so many cases now that that is certainly possible.
Second question, we have a viewer in Otay Mesa who says, I am in remission for cancer and have asthma. Do you think I should self-quarantine even though I feel fine?
Yes, definitely. That is a very high-risk person. They have a compromised immune system,
right,
plus an underlying respiratory illness. No question about that.
Okay, the third question is, hi, good morning. Quick question, is it safe to ride public transportation?
So at this point, we're asking everyone to stay put and not go anywhere unless you have an extremely essential, critical job that you've been asked to show up for. So if you have to ride public transportation, just take every precaution. Treat every surface like it might be contaminated before you touch it. So if you are able to wipe down a surface with an alcohol wipe before touching it, or immediately wash and sanitize your hands afterwards, or even do both. So we were asking everyone to take the utmost precautions, stay put, don't leave the house unless you absolutely have to.
Some rumors floating around about what might help in the fight against this. Eating garlic, will it help prevent infection with the new coronavirus? I would imagine that the garlic might actually help with the social distancing, but expand on that if you don't mind.
Yes, I actually said that in one of my podcasts earlier this week. Yes, it's not going to help with any immunity. Garlic is a great food. It's a superfood. It has anti-inflammatory properties, but in this case, it's not going to help with your immunity at all. The best thing we can do is wash our hands, continue social distancing, and really avoid unnecessary social contact.
We have to wrap, but I really want to ask you this. How long does the virus live on surfaces and droplets in the air? Let's say someone sneezes and there's a cloud. How long do those droplets live for?
So we have some new information on this coming out of the New England Journal of Medicine. I believe it was published yesterday, that it can actually hang in the air for up to 3 hours. And I heard this yesterday, but I wasn't certain of it. So I was looking at that article just early this morning. If someone sneezes, it takes about 10 feet before the droplets hit the ground and are no longer airborne. And that's a pretty far distance.
Sure.
Yeah.
We saw it. Again, this is one article, and it's not. This is just one study, so we have to bear in mind that we need more evidence. There's also I believe in that same study, evidence that it can live on a metal surface for 12 hours.
Mm-hmm.
If you come in contact with a metal surface, you want to wash your hands as soon as you can with soap. And then on fabric, it can also survive for 6 to 12 hours.
Wow, this is all new information.
Yeah, all right. Dr. Nanos,
So
really...
normal laundry detergent will kill it. So
Okay.
don't go to any extreme measures. Okay.
Good to hear.
Dr. Nanos, thank you so much. I know our viewers have a lot of questions, and thank you so much for answering some of them. That's interesting information about
and no
the
question's
droplets.
a bad question.
No,
right?
No.
People asking about the clothing, cardboard surfaces, Amazon packages that are coming in.
These are all legit stuff.
People sneeze. If you see someone that does if it ain't going to linger for 3 hours, it's best to maybe just take an alternate route.
Taking your shoes off when you get home, too. Dr. Nanos, thank you so much. Let's go ahead and check in with Heather for a look outside.